Fastest growing procedure in all of sports medicine. New advances in instrumentation now allow us to get into the hip using a camera and small incisions to correct pathology in the hip. It presents earlier in athletes because of how rigorously they use their hips. It also occurs in older people as well. Usually if you're not an athlete, then it may show up later in life in your 40s or 50s when the tear becomes more and more chronic and extensive. Okay, see you back in about 4 weeks. Most patients will have groin pain. Many of them will describe pain sort of throughout the hip, and a classic sign is the C sign, where they grab their hip like this, and that pain is deep inside the hip. Hip arthroscopy, again, is done through small incisions in a camera. We distract the hip gradually to get into the joint, and it's usually a combination of different procedures. Typically there's either a repair or a debridement performed of the torn labrum. Adjacent to that torn labrum, there's commonly damaged cartilage, and so that is cleaned up as well. And then there's also a procedure called a femoroplasty, where the extra bone that's been causing the impingement and the labrum tear is shaved down to try to prevent that impingement from happening in the future. Well, the expectation is that the patient's pain goes away forever. And by eliminating the impingement, there is evidence that you can prevent that hip from becoming arthritic down the road, and perhaps even needing a hip replacement. I do quite a bit of hip arthroscopy. I'm one of the few surgeons in Central Valley who performs the procedure, and it's been a very satisfying procedure to do, because I see a lot of athletes return to their sport, and I see a lot of older people who have had this for many years, have good pain relief and good functional recovery, and get back to their normal level of exercise.